Hi there, Dr. Rajeev Iyer here from IMG Secrets, coming with the experience of coaching and mentoring hundreds of international medical graduates like you. In this video, I'm going to tell you 6 paths that can happen after doing a clinical fellowship in Canada. And let's do this together. The very first thing that can happen is you get a job in Canada as a consultant or an attending physician. This is perhaps the coolest thing that can happen to your career, that you do a year or two of fellowship and then directly be a consultant. Now, how this works is your clinical fellowship experience would be considered a significant clinical experience when you move on to the next steps in Canada. Of course, the prospects of getting a job would depend on how outstanding of a candidate you are, plus the availability of jobs in your specialization at the time when you're ready to apply for a job. Now, this is exactly where our expertise in terms of coaching and mentoring IMGs to help them succeed through this pathway. Is it easy? Certainly not. Can you achieve it? Yes, through being very strategic and coming through a strong application is what can help you be successful in these pathways. The second thing that can happen is you obtain a license to practice your specialization in Canada. Now, this can happen through various different ways. You could get a hospital-specific license, which can then transition to a provincial-based license, or you could get a license through one of the Royal College accredited pathways. Ultimately, this clinical fellowship is helping you land a job and then subsequently helping you get a license to practice your specialization. The third thing that can happen is you can get a job in the USA. Now, how this works is your clinical fellowship experience is considered a very significant experience both in Canada and the USA. So Canadian training is more or less considered equivalent to US training. So this experience will help you land a job in the US. An example of someone happening, it's me. And this is the path I took, where I did Canadian fellowships and then used that experience to an attending or a consultant job in the USA. And this is exactly what we mentor when IMGs speak to us, depending on their eligibility, and tell them how to approach these pathways. Making sense? The fourth thing that can happen is you get a permanent residency in Canada through your clinical fellowship. And in fact, in our opinion, this probably is the best way of getting a permanent residency in Canada. Now, how this works is the clinical fellowship experience belongs to one of those categories that actually will give you a Canadian experience class when you apply to be a permanent resident in Canada. In fact, we have seen people applying through this pathway and being successful in getting their PRship in just a span of few months. This is so fantastic. And hence, we always recommend moving through this clinical fellowship pathway and then securing a job, securing a license, and securing a permanent residency as well. The fifth thing that can happen is this can help you get back into a residency training program either in Canada or the USA. How this happens is there are some specialties that are extremely competitive. And if you get a clinical fellowship in one of these specialties, this clinical experience can significantly boost your CV, and many times you may have to end up repeating residency or PG in Canada, and this experience will actually help you match into those residency programs so you become successful in getting through the Canadian or the US system using this fellowship as an experience. And we see this happen quite frequently in the US, that IMGs come and do a clinical fellowship, and if you do end up doing a clinical fellowship in the USA and you eventually want to do residency in Canada, you can certainly use that experience as well. Now, hold on. If all this seems very confusing for you, which I can understand it can be because there is a lot of information here, you can always book an appointment and obtain mentorship from us. And this will be one-on-one, where we sit with you on a video call and talk to you about your career options and then guide you through your next steps. And the last thing that can happen is you go back to your home country, and many people, many IMGs actually do this by choice because they would have come to Canada to do a funded fellowship, or their goal would be to eventually go back to their home country, and this Canadian experience can actually give them a significant boost in their career, in their pay, in their home countries. And this usually happens in countries like the Middle East most frequently, plus a few other countries. Now, I encourage you to check this video out, where I've told you how to apply for a clinical fellowship in Canada so you become successful in your career. Of course, any questions, do post in the comments below. We'll try to get back to you as soon as possible. Take care, stay safe. We will talk to you soon.